Hi friends, welcome to the channel The Nurse. Here we are discussing about DHA exam questions for nurses. So it will be helpful for preparing DHA, Dubai Health Authority exam for nurses. And these are the basic questions. So I just giving an idea to attend to the DHA exams. So you can prepare it well for before the exams. So before starting the exam questions, if you are not subscribed to our channel, please subscribe, and we will move to the topic. DHA exam questions for nurses. First question: what is the difference between heart failure and cardiac arrest? Heart failure is a chronic condition, while cardiac arrest is a sudden event. Heart failure involves a failure of the heart muscles to pump blood effectively, while cardiac arrest is the cessation of the heartbeat. Heart failure only affects the lungs, while cardiac arrest affects the entire body. Heart failure is a temporary condition, while cardiac arrest is a permanent. So here correct answer is option B, that is heart failure involves a failure of the heart muscles to pump blood effectively, while cardiac arrest is a cessation of heartbeat. Heart failure is a condition in which the heart muscle is weakened and unable to pump blood effectively into the systemic and pulmonary circulation, while cardiac arrest is a sudden cessation of the heartbeat. The heart working condition is stopping abruptly, then it leads to cardiac death. So if cardiac arrest is there, means you need to start CPR. What is the role of nurse in preventing healthcare associated infections? Prescribing antibiotics, washing hands frequently, cleaning and disinfecting equipments and surfaces. And option D is both B and C. Correct answer is option D, that is both option B and C, that is washing hands frequently, cleaning and disinfecting equipments and surfaces. Nurses play a key role in preventing healthcare associated infections by taking steps such as washing their hands frequently, cleaning and disinfecting equipments and surfaces, and following infection control protocols. So by taking these actions, nurses helps to minimize the risk of infection spreading from patient to patients. So what is the hospital associated infection, that is commonly known as in which term? So you can comment it below. And what is the infections that is caused to because of any treatment or through any surgical procedures? So that also you can comment below. One is hospital associated infection term, and another term is the infection spread through any procedure or any surgery. Third question: what is the primary function of the respiratory system? To distribute oxygen to the body's tissue, to eliminate carbon dioxide from the body, to regulate blood pressure, to regulate body temperature. Here correct answer is to distribute oxygen to the body's tissue. The primary function of the respiratory system is to distribute oxygen to the body's tissue. The respiratory system is responsible for bringing oxygen into the body and removing carbon dioxide. Oxygen is taken in through inhalation and delivered to the body tissues through the bloodstream. Then fourth question: what is the difference between acute pain and chronic pain? Acute pain is temporary and resolves on its own, while chronic pain is long lasting and persistent. Acute pain is always severe, while chronic pain is always mild. Acute pain is always caused by injury or illness, while chronic pain is always caused by psychological factors. Acute pain is always felt in one specific location, while chronic pain can be felt throughout the body. Here correct answer is option A, that is acute pain is temporary and resolves on its own, while chronic pain is long lasting and persistent. If acute pain is long lasting, means if it is more than 6 months, means it is called chronic pain. The pain that duration that is less than 6 months, that is known as acute pain. Acute pain is typically a response to injury or illness and resolves on its own once the underlying cause is treated. Acute pain is due to some injury or illness. So if it is the illness or injury is solved, then pain also will resolve. Same time, chronic pain on the other hand is long lasting and persistent, that is more than 6 months. If the pain is persists there for more than 6 months, it is called chronic pain. And it can be caused by a variety of underlying conditions. There will be varieties of conditions for chronic pain. It may be physical or psychological reason. Fifth question, what is the significance of vital signs in patient assessment? Vital signs produce a snapshot of the patient's overall health status. Vital signs are used to monitor the effectiveness of treatment. Vital signs can indicate the presence of underlying medical conditions, all of the above. Here correct answer is all of the above, that is fourth options. Vital signs such as temperature, heart rate, blood pressure and respiratory rate provide important information about a patient's overall health status and can be used to monitor the effectiveness of treatment, indicate the presence of underlying medical condition and guide clinical decision making. So vital signs plays important role in monitoring patients' overall health status, and it also helps to monitor the progression of the treatment, and it also gives a clinical decision making. It also helps in making clinical decision. Sixth question, what is the role of the nurse in the administration of medication? Selecting the appropriate medication for the patient, checking the patient's medical history of any contraindication, administering the medication in the correct dose and at the correct time, monitoring the patient's response to the medication, documenting the administration of the medication, all of the above. So nurse's role, that is all given. The five options are correct only. So that are the responsibility of the nurses while administering the medication. The nurse plays a critical role in the administration of medication, from selecting the appropriate medication for the patient, checking for contraindications, administering the medication in the correct dose and at the correct time, monitoring the patient's response to the medication and documenting the administration. By following these steps, the nurse helps to ensure that the patient receives safe and effective medication therapy. Seventh question, what is the difference between aseptic and sterile techniques? Aseptic techniques are used for minor procedures, while sterile techniques are used for major procedures. Aseptic techniques involves use of antiseptic agents, while sterile techniques do not. Aseptic techniques are used to minimize the risk of infection, while sterile techniques are used to eliminate the risk of infection. Aseptic techniques are used in the operating room, while sterile techniques are used in the ICU. Correct answer is option C, that is aseptic techniques are used to minimize the risk of infection, while sterile techniques are used to eliminate the risk of infection. Aseptic techniques are used to minimize the risk of infection by using antiseptic agents and following infection control protocols, while sterile techniques are used to eliminate the risk of infection by using sterile equipments and following strict aseptic procedures in a controlled environment such as the operating room. So that is a main difference between aseptic and sterile techniques. Aseptic techniques, it helps to reduce the risk of infection, while sterile techniques are used to eliminate, it removes the risk of infection by applying use of sterile equipments and strict aseptic procedures in a controlled environment like operating room. What is the purpose of wound care? To prevent infection, to promote healing, to reduce pain, all of the above. Purpose of wound care includes all the above options, that is to prevent infection, to promote healing, to reduce pain. The purpose of wound care is prevent infection, promote healing and reduce pain. This may involve cleaning and dressing the wound, using topical medications or wound dressings, and monitoring the wound for signs of infection or other complications. Ninth question. What is the significance of patient education in nursing practice? It empowers patients to take an active role in their own care. It improves patient outcomes. It helps to reduce the risk of adverse events. All of the above. So, what the question is asking, what is the need of health education, patient health education? So, here correct answer is option D. All the above options are correct. It empowers patients to take an active role in their own care. It improves patient outcome and it helps to reduce the risk of adverse event. Then 10th question. What is the difference between palliative care and hospice care? Palliative care is provided in a hospital setting, while hospice care is provided in a hospice facility. Palliative care focuses on treating the underlying disease, while hospice care focuses on symptom management. Palliative care is provided to patients who are expected to recover, while hospice care is provided to patients who are near to the end of life. Palliative care is provided to patients with life-limiting illness, while hospice care is provided to patients with life-threatening illness. Here correct answer is option D. That is, palliative care is provided to patients with life-limiting illness, while hospice care is provided to patients with life-threatening illness. So usually hospice care given to the patients those who are expected to die within 6 months. So end stage care will be given in hospice care. Palliative care that is provided to patients with life limiting illness. Maybe the patient's life will long for more than 6 months and the patients needed some comfort care to extend their life. Palliative care is comfort care with or without curative intent. So in the palliative care, there will with the palliative care, the patient's symptoms or patient's condition will cure sometimes, or sometimes it will not cure, but it will help to extend the life. So the important point is it will cure or without cure the condition, but it will extend the life. Same time, hospice means it is also a comfort care without curative intent. So in palliative care, with or without curative intent, but hospice care, it is indication that is without curative intent. It means the life will longs within the patient may die within 6 months. So that is what mean curative without curative intent. The patient no longer has curative options because there is no options to cure the conditions, as chosen not to pursue the treatment because of the side effects outweigh the benefits. That means the treatment or the planned treatment, it will have some side effects that more than the side effects problem more than the benefits. So in that two conditions, hospice care will be given for the patients. So this is the main difference between palliative care and hospice care. Palliative care that is also a comfort care, and hospice also a comfort care. But in the case of palliative care, there is a chance of cure the condition. But in the hospice care, the plan is it will not cure the patient condition, but it will give a comfort to the patients till the life ends. 11th question. What is the importance of hand hygiene in healthcare? To prevent the spread of infection, to maintain the cleanliness of hands, to reduce the risk of cross-contamination, all of the above. Correct answer is all of the above. Hand hygiene helps to reduce the infection chance. Hand hygiene is a critical aspect of infection control in healthcare. By regularly washing their hands and using hand sanitizer, healthcare workers can prevent the spread of infection, maintain the cleanliness of their hands, and reduce the risk of cross-contamination. And this helps to protect patients and prevent the spread of disease. So that is what hand hygiene is very important in infection control nursing. 12th question. What is the purpose of taking a patient's vital signs? to assess the patient's overall health status, to monitor patient's response to the treatment, to detect the changes in the patient's condition, all the above. I think this question is discussed the previous. Correct answer is all the above. Taking a patient's vital signs such as blood pressure, heart rate, respiratory rate and temperature is a critical aspect of patient assessment and monitoring. By regularly taking and recording vital signs, healthcare workers can assess the patient's overall health status, monitor the patient's response to the treatment and detect changes in the patient's condition that may indicate a problem. 13th question. What is the difference between a complete blood count and a basic metabolic panel? The CBC or complete blood count measures all components of the blood, while a BMP only measures electrolytes. CBC measures red blood cell count, while a BMP measures glucose level. CBC measures white blood cell count, while a BMP measures kidney functions. CBC measures platelet count, while a BMP measures cardiac functions. Correct answer is CBC measures white blood cell count, while a BMP measures kidney functions. Not only white blood cells count, it will measure red blood cell count, platelet counts, etc. Along with BMP, it will measure electrolytes, kidney functions, liver functions, etc. A complete blood count is a blood test that measures a various components of the blood, including red blood cells, white blood cells, and platelet count. Same times, a basic metabolic panel or BMP is a blood test that measures electrolyte level, glucose level, kidney functions, and liver function. These tests provide important information about the patient's health status and are used to diagnose and monitor various medical conditions. So these are the two basic blood investigations. CBC will give idea about the components of red blood cells count, white blood cells count, platelet count, and at the same time basic metabolic panel will give an idea about patient's electrolytes level, glucose level, kidney functions and liver functions, and it will help to diagnose the conditions. And 14th question, what is the role of nurse in patient discharge planning? Assessing the patient's need and ability to manage their care at home, coordinating with healthcare providers to ensure a smooth transition of care, educating the patients and their family about self-care and follow-up appointments, all of the above. Correct answer is all of the above. The nurse plays critical role in patient discharge planning, which involves assessing the patient's needs and ability to manage their care at home, coordinating with healthcare providers to ensure a smooth transition of care, that is from hospital to home, and educating the patient and their family about self-care and follow-up appointments. By following these steps, nurse helps to ensure that the patient has the information and support they need to continue their recovery at home. Then last question, what is the significance of informed consent in healthcare? It ensures the patient are aware of the risks and benefits of treatment or procedure. It gives patients the right to make informed decisions about their care. It helps to protect the patient's autonomy and dignity. Last option is all of the above. Here also correct answer is all the above. An informed consent is a critical aspect of the patient-centered care in healthcare. By obtaining informed consent, healthcare providers ensure that patients are aware of the risk. So that is about today's video. 15th question we have discussed about DHA exams questions for nurses. So if you have any doubt means you can ask in comment sections. So thank you. Thank you for watching this video and also subscribe the channel The Nurse. If you like this video, please share with your friends and don't forget to subscribe our channel The Nurse. So see you with next video. Till then, bye bye.